Most people have been led to believe that as you grow older, your vision is simply going to decline, that it's inevitable, that you just learn to live with it. You start your mornings with eyes that feel rough and irritated. You strain to read a menu from across the table. You find yourself dreading nighttime drives because oncoming headlights feel almost blinding, and your hands tighten on the wheel in a way they never used to. But what if that assumption is wrong? What if what you've been told is only half the story? Here's what the medical community doesn't always make time to explain clearly. The American Optometric Association acknowledges this plainly. After the age of 60, your eyes enter a phase of heightened vulnerability. Dry eye syndrome, lens clouding, macular deterioration, and sudden one-sided vision changes all become dramatically more likely. Meanwhile, the National Eye Institute has raised alarms that Americans are experiencing vision loss at a rate never before seen in recorded history. And here's the part that catches most people completely off guard. The most serious damage to your eyes doesn't happen during the day. It happens at night while you're sleeping, while you believe your body is quietly healing. Your retina, the thin, light-sensitive layer at the back of your eye that makes vision possible, is often starved of oxygen and nutrients during those nighttime hours. The photoreceptor cells responsible for sharp, detailed sight slowly begin to deteriorate, quietly, without warning signs. And by the time most people notice something is wrong, significant damage has already taken hold. The question I get asked more than almost any other in my work is this: why does my vision keep getting worse? And is there a natural path forward that doesn't involve lifelong prescriptions or invasive procedures? The uncomfortable answer is that most mainstream treatments, lubricating drops, upgraded lenses, laser correction, are designed to manage what you feel, not fix what's causing it. That's a fundamental problem, and it's one reason the eye care industry generates enormous profits year after year while patients continue to struggle. Research published in JAMA Ophthalmology in 2023 brought to light something that scientists had been building toward for years. The earliest stages of age-related retinal decline involve two processes working silently beneath the surface: oxidative cellular stress and persistent low-grade inflammation. Both of these are most active during the nighttime hours, which is precisely when your eyes need to be repairing themselves. Here's where things get genuinely hopeful, and I don't say that lightly. Emerging nutritional research has identified specific natural compounds found in common fruits, compounds that your eye tissue is actively depleted of as you age. These substances have been shown to assist in rebuilding damaged photoreceptor cells, enhance blood flow to the retina, and interrupt the slow progression of macular degeneration, which continues to be the single most common cause of permanent central vision loss in people over 60. What this means is that you may have a real, evidence-supported opportunity to nourish your vision from the inside out while you sleep, without another specialist visit or another medication added to your routine. And the fruit at the top of this list will likely catch you off guard. It's something you've probably already got at home. It contains a naturally occurring enzyme that researchers have found may actively disrupt one of the key chemical processes responsible for lens clouding and early cataract development. My name is Dr. Lauren Hayes. For years, I've worked alongside older adults who want to take an active, informed role in preserving their eyesight through approaches that are grounded in science and don't require abandoning conventional care. What I'm sharing today are 7 fruits that current research links to overnight eye tissue repair, and the specific, practical ways to use them that most people get completely wrong. Before we dive in, I have a small request. Tell me where in the world you're joining from today. Drop your city or country in the comments. We're growing a community of people who believe vision loss is worth fighting, not simply accepting. One more thing I want to be transparent about. What I'm presenting here is for educational purposes only. It is absolutely not a replacement for personalized medical care. If your vision has changed in any way, blurriness, distortion, dryness, anything, please consult a qualified eye care professional before adjusting your diet, your supplements, or your daily habits. Your eyesight is not something to experiment with carelessly. Now, let's go through the list, starting from number 7. Number 7 might be the most underestimated fruit in the produce section. Small, slightly rough on the outside, and almost always overlooked. But what it does for aging eyes is backed by real science. Here's the problem it addresses. Your retina, the tissue responsible for translating incoming light into the visual information your brain interprets, becomes increasingly fragile with age. Free radicals accumulate and begin breaking down retinal cells. The result is the kind of gradual vision decline most people chalk up to getting older, struggling to read distant signs, seeing halos or starbursts around lights at night, or waking up every morning with vision that takes far too long to sharpen. This isn't just wear and tear, it's measurable cellular damage, and researchers are learning it can be slowed. Kiwi contains two compounds that appear repeatedly in eye health research: lutein and zeaxanthin. These act as built-in protective filters within the retinal layers, shielding cells from damaging blue light and bolstering antioxidant defenses precisely during the overnight repair window. Kiwi also contains a combination of antioxidants alongside naturally occurring serotonin, a compound that promotes higher quality sleep. Since the deepest repair work your eyes do happens during deep sleep, this connection is more significant than most people realize. A study published in the Journal of Nutrition and Healthy Aging documented that older adults who ate 2 golden kiwis per day saw real, measurable gains in visual clarity, along with noticeable reductions in morning eye dryness and redness. That's a meaningful result from something most people walk past in the grocery store. How to use it: 2 golden kiwis, specifically golden, not green, consumed roughly an hour before bed. Golden varieties carry a higher lutein concentration, are gentler on digestion, and produce less stomach acid, which matters when you're eating close to sleep. One detail almost no one knows: don't scrape the flesh all the way to the edge. The thin layer of fruit just inside the skin holds concentrated caffeic acid, a potent antioxidant. Use a spoon, scoop from the center, and leave that borderline flesh behind. Better night vision, less morning dryness, no medication required. Number 6 is something most people already enjoy: watermelon. But if you've ever experienced that foggy, blurry period after waking up that drags on longer than it should, this one deserves your attention. As the body ages, tear production slows and the eyes lose moisture more rapidly. Circulation to the retina also diminishes. Both factors contribute directly to that maddening morning haze that some people live with for hours each day. Watermelon's hydration content, over 90% water, is well known. But what the research highlights goes deeper than that. Watermelon is among the top dietary sources of lycopene, a carotenoid antioxidant with documented links to reduced oxidative injury in retinal tissue and observational associations with lower rates of both cataracts and macular degeneration. People who eat watermelon consistently also tend to show elevated blood levels of lutein and zeaxanthin, the same retinal protective nutrients discussed with kiwi. Certain natural compounds in watermelon have also been shown to stimulate nitric oxide synthesis, promoting improved circulation in small peripheral blood vessels, which may translate to better nutrient and oxygen delivery to your retina while you sleep. How to use it: 1 to 2 cups of seedless watermelon, chilled, about 30 minutes before bedtime. Do not add salt. Elevated sodium intake can increase intraocular pressure, a recognized and serious risk factor for glaucoma-related damage according to the Glaucoma Research Foundation. Pro tip: don't discard the white rind. That pale section closest to the green outer layer contains citrulline, an amino acid that promotes healthy vascular function and may contribute to overnight retinal nourishment. Blend it into a smoothie, or if you're up for something different, try lightly pickling it. 5th on the list is a fruit that most people in the grocery store wouldn't recognize: black currants. They're small, deeply pigmented, and easy to overlook. But for aging eyes, particularly those struggling with low light vision, they're remarkably effective. The specific issue they target is twofold: persistent low-grade retinal inflammation and compromised circulation to the optic nerve. Over months and years, these two processes quietly erode your ability to see clearly in dim conditions, produce glare and halos around nighttime light sources, and cause mounting visual fatigue. A stronger prescription doesn't address any of this at the source. The active compounds responsible for black currants' benefits are anthocyanins, the same pigments that give the berries their near-black color. Within the eye, anthocyanins work across multiple pathways simultaneously. They reduce inflammatory activity, encourage blood vessel relaxation and widening, and support the regeneration of rhodopsin, the pigment your eyes depend on to adjust when moving from bright to dark environments. Clinical evidence supports this meaningfully. A controlled trial with glaucoma patients demonstrated that 50 milligrams of blackcurrant anthocyanins taken daily for 2 years produced significant improvements in optic nerve blood flow and noticeably slowed the progression of visual field loss relative to placebo. A separate pilot study showed similar compounds increased retinal circulation without elevating eye pressure and helped regulate a vessel-constricting compound in the blood. Evidence also points to improved dark adaptation, the speed at which your eyes recover when transitioning between light and dim spaces, which is highly relevant for women over 60 who experience difficulty with night driving or navigating differently lit rooms. How to use it. Fresh black currants are rarely stocked in conventional supermarkets. Seek out a standardized extract of blackcurrant anthocyanins at approximately 50 milligrams per day, taken with your evening fruit routine. To maximize absorption, consume alongside a small healthy fat source such as walnuts, or with something vitamin C rich like a slice of orange. These nutrients work better together than they do alone. Number 4 is probably already a regular part of your diet: blueberries. But most people are consuming them in a way that significantly undermines their effectiveness for eye health. What blueberries address is oxidative damage to the photoreceptor cells, the specialized retinal cells responsible for visual sharpness, fine detail, and the ability to adjust as lighting changes. Cumulative UV damage, thinning antioxidant reserves, and years of cellular stress all converge in ways that show up as squinting, blurry vision even with corrective lenses, and difficulty seeing in lower light. The primary active compound in blueberries is pterostilbene, structurally related to resveratrol, but with substantially higher bioavailability. What makes it particularly relevant to eye health is its ability to cross the blood-retinal barrier, allowing it to act directly on DNA-level damage in photoreceptor cells. That distinguishes it from the majority of dietary antioxidants, which are metabolized before they ever reach the tissue that most needs protection. A 2023 study in nutritional neuroscience found that seniors who ate wild blueberries daily over 12 weeks demonstrated measurable gains in visual acuity and significantly less eye strain during screen use in low-light settings. The variety matters enormously. Large, glossy supermarket blueberries, the cultivated kind, test noticeably lower in antioxidant concentration than wild blueberries. Wild blueberries are smaller, darker, and typically found in the frozen aisle. Frozen is equally effective as fresh. Don't let that stop you. How to use them. Approximately 1/3 of a cup of wild blueberries, eaten 45 minutes before bed. Critical point: avoid combining with any dairy product. Milk proteins bind directly to anthocyanins in the digestive tract, physically preventing their absorption. Instead, allow your blueberries to partially freeze and then thaw before eating. This simple step ruptures cell walls and releases significantly more of the active compounds, making them far more accessible during overnight eye repair. Third on our list is one that genuinely surprises most people: dragon fruit. Visually dramatic, increasingly available, and according to recent research, one of the most effective fruits for improving oxygen flow to retinal tissue overnight. If your mornings consistently start with eyes that feel exhausted and heavy, even when you've slept a full 7 or 8 hours, this fruit may speak directly to what's happening. The mechanism it targets is retinal hypoxia, a condition in which retinal cells aren't receiving sufficient oxygen during sleep. When this occurs, rest alone isn't enough to restore your eyes. You wake feeling unrested in your vision specifically. Your side vision becomes less reliable. Colors lose their richness. And over time, without intervention, the tissue degradation accumulates. Red-fleshed dragon fruit is particularly concentrated in betalains, a class of antioxidants that appear to stimulate nitric oxide release in vascular tissue. Nitric oxide expands blood vessels, including the microscopic capillaries that nourish your retina, allowing for greater oxygen and nutrient transfer during the deepest phases of sleep. A 2022 publication in Frontiers in Aging Biology found that 6 weeks of red dragon fruit extract supplementation produced meaningful improvements in ocular blood flow, contrast sensitivity, and depth of visual field in study participants. Practically speaking, participants reported clearer low-light vision and measurably less blurring in daily life. How to use it. Half of a red-fleshed dragon fruit. The white varieties do not contain betalains in meaningful amounts, approximately 1 hour before sleep. Do not swallow the small black seeds whole, chew them thoroughly. They contain both omega-3 fatty acids and magnesium, both of which are involved in retinal nerve maintenance and overnight regeneration. Swallowing them intact means your body absorbs almost none of those nutrients. Second on the list is goji berries, small, red, and slightly sweet, with a documented history in traditional medicine spanning more than 2,000 years, specifically in relation to eye health. Modern clinical science is now catching up with what practitioners observed empirically for generations. The precise target here is macular thinning. Your macula is the high-resolution zone at the center of your retina. Everything involving sharp detail, text, faces, color discrimination depends on it. As the years pass, oxidative damage and reduced blood supply to this area gradually thin and degrade the macular tissue. This is the biological foundation of age-related macular degeneration, which remains among the most prevalent causes of irreversible central vision loss in older adults globally. Goji berries stand apart because of their zeaxanthin concentration. They rank among the richest dietary sources of this compound anywhere in the natural food supply. Where lutein primarily shields the outer retinal layers, zeaxanthin concentrates specifically at the macula. That spatial specificity is part of what makes goji berries so relevant to macular health. A 2021 clinical trial published in Nutrients enrolled adults between 60 and 80 years old who ate dried goji berries 5 days per week across a 90-day period. Results showed a statistically significant increase in macular pigment optical density, a measurable indicator of how well protected the macula is, and critically, not a single participant experienced any detectable progression of macular degeneration throughout the study. For anyone genuinely concerned about maintaining visual independence, that outcome is worth taking seriously. How to use them. Soak 2 tablespoons of dried goji berries in warm water for 10 minutes to soften them, then eat them about 30 minutes before bed. The soaking step improves both texture and digestibility, which is particularly relevant for older digestive systems. Pro tip: accompany your goji berries with a small piece of high-quality dark chocolate, minimum 85% cacao content. The flavonoids naturally present in cocoa have been shown in research to enhance zeaxanthin absorption. These two foods together create a nutritional pairing your macula can actually put to use. And at the top of this list, the single most powerful fruit for your aging eyes is papaya. It isn't rare. It isn't expensive. There's a good chance one is sitting in your kitchen already. But consumed correctly at the right time, it takes aim at one of the most harmful and least discussed processes behind age-related vision deterioration. The enemy papaya targets is glycation. This is the biochemical process in which excess blood glucose attaches to proteins throughout the body, including delicate proteins inside your eye. Over time, these bonds produce advanced glycation end products, or AGs, which progressively cloud the crystalline lens and erode the retinal lining. Glycation is one of the most common and under-recognized contributors to blurry vision, cloudy lenses, and early cataract development in people over 60, and it's happening continuously beneath the surface in most of them. Papaya contains papain, a naturally occurring enzyme with well-documented anti-inflammatory properties and the ability to interact with protein structures in ways that may interfere with glycation's damaging effects. Beyond papain, papaya delivers a concentrated trio of vitamins A, C, and E alongside folate, a nutritional combination that research repeatedly associates with tear film stability, retinal antioxidant defense, and reduced inflammatory activity within the eye. A 2023 study in clinical gerontology found that older adults who ate papaya in the evening demonstrated lower circulating glycation markers at follow-up, along with measurably improved tear production and notable gains in contrast vision, the ability to distinguish subtle differences in light and shadow within just 6 weeks. For anyone living with persistent dry eyes, blurry mornings, or early cataract symptoms, those are meaningful real-world changes. How to use it. 1 cup of ripe, fresh papaya cut into cubes, eaten approximately 1 hour before going to bed. 2 things are non-negotiable here. Fresh papaya outperforms anything processed or packaged, and cold papaya is significantly less effective than room temperature papaya. Refrigeration slows enzyme activity, and papain needs to be fully active to do its work. Remove your papaya from the refrigerator 30 to 60 minutes before eating it. As with blueberries, avoid combining with any dairy product. Pro tip: add a generous squeeze of fresh lime juice before eating. Lime's vitamin C content has been shown to enhance your body's uptake of vitamin A from papaya, giving your eyes more of what they actually need. It also makes the fruit taste considerably better, which is never a bad thing. Before we close, there are 5 principles I need you to understand, because without them, you could follow this entire fruit list faithfully and still not experience the benefits you're hoping for. Rule 1: keep dairy separate. Consuming these fruits within 90 minutes of milk, yogurt, or calcium-enriched foods actively suppresses your body's ability to absorb lutein and zeaxanthin. Studies have shown calcium-heavy meals can reduce uptake of these critical eye nutrients by nearly 30%. Treat your evening fruit as its own separate snack. Give it space. Rule 2, always include a small amount of healthy fat. Lutein, zeaxanthin, lycopene, and several other compounds in these fruits are fat-soluble, meaning they require dietary fat to be absorbed at all. A small handful of walnuts, a teaspoon of flaxseed oil, or a few slices of avocado alongside your fruit can increase absorption by more than 50% according to published research. You're eating the same food and getting dramatically more from it. Rule 3, wash gently. Vigorous rinsing under forceful water physically strips away surface antioxidants, particularly problematic with blueberries and black currants, where the most valuable compounds are concentrated just beneath and on the skin. Use cool water, a light touch, and wash right before eating rather than hours ahead of time. Rule 4. Bring fruit to room temperature before eating. Cold suppresses enzymatic activity in several of these fruits, most critically in papaya. Chilled papaya delivers a fraction of the papain benefit that room temperature papaya does. Pull your fruit from the fridge well before you plan to eat it and allow it to fully warm up. Rule 5, time it precisely. Eat your evening fruits 60 to 90 minutes before sleeping. Earlier than that, and the active compounds are already being cleared from your system before your eyes reach their primary repair phase. Later than that, and the digestive activity itself interferes with the deep sleep your eyes need to actually regenerate. That 60 to 90-minute window is where the real benefit lives. Let's land this where it matters. Declining vision is not something you are simply required to accept as the price of growing older. In many cases, it is the result of specific, identifiable biological processes: oxidative cellular damage, chronic inflammation, impaired circulation, and glycation, all of which nutritional research is increasingly showing can be meaningfully influenced by what you eat, when you eat it, and how. Imagine picking up a book without straining, driving at night with confidence instead of anxiety, opening your eyes in the morning and seeing the world clearly, right away, without that long, foggy wait, recognizing faces, seeing the details of the people and places you love. That's not a small thing. That is your independence, your quality of life, your connection to the world around you. I'd love to hear from you. If you woke up tomorrow with noticeably clearer vision, what's the first thing you'd want to see? Leave it in the comments. Your family, the sky, the garden, whatever it is. I read every response, and I genuinely mean that. If this was useful, please like the video and subscribe. Share it with someone over 60 who deserves to know this information exists. You might genuinely improve someone's life by doing so. This is Dr. Lauren Hayes. Protect your eyes. They are truly irreplaceable. I'll see you in the next one.